Water fluoridation, why it's needed for Utah County. What is water fluoridation? Well, water fluoridation is the controlled addition of fluoride to a public water supply to reduce tooth decay. Fluoridation or fluoridated water contains fluoride at a level that is effective for preventing cavities. This can occur naturally or by adding fluoride. Bottled water typically has unknown fluoride levels. Why does Utah County need fluoride in the water source? Well, only 2 out of 21 communities in Utah County have enough fluoride in the water source to prevent tooth decay. Most communities have only 0.1 to 0.35 milligrams of fluoride per 1 liter of water in their water source. We know that we need at least 0.7 milligrams of fluoride per 1 liter of water in the water source to prevent decay. Fluoride at the 0.7 milligrams per 1 liter of water has proven to prevent at least 25% of cavities in a person's lifetime. Fluoride, the superhero that lives inside your mouth. What is fluoride? Fluoride hails from the planet Earth. It's found naturally in rocks, soil, and water, but fluoride doesn't exist on its own. Like so many superheroes, it's created through a scientific process. Fluoride is actually a chemical ion of fluorine, one of the top 20 most common elements in the Earth's crust. An ion is a positively or negatively charged atom that helps elements combine with one another. When fluorine, which is negatively charged, meets a positively charged ion like sodium, cavity fighters are born. When these fluoride compounds are in your mouth, they can actually make your teeth stronger and prevent cavities. They can even reverse early tooth decay. How does fluoride fight cavities? To begin, let's look at what fluoride is working so hard to protect, your teeth. Tooth enamel is the outer covering of your teeth. It's stronger than bone and made from calcium and phosphate. Your spit or saliva is also loaded with calcium and phosphate and bathes the teeth to keep them strong. When you eat things like candy, crackers, or noodles, cavity-causing bacteria starts feasting on the carbohydrates in these foods. This produces acids that attack your enamel. It causes calcium and phosphate to be stripped from the tooth enamel, leaving you more vulnerable to decay and cavities. However, saliva disrupts the attack as it coats your teeth and adds back calcium and phosphate to replace what had been stripped away. Now, here's where fluoride is the superhero. When your saliva has fluoride in it from sources like toothpaste or water, your teeth are able to take it in. Once in your enamel, fluoride teams up with calcium and phosphate there to create the most powerful defense system your teeth can have to prevent cavities from forming. Fluoroapatite. It's much stronger, more resistant to decay, and fights to protect your teeth. How can I get fluoride to help me? There are many ways to get fluoride fighting for you. It is found in some mouth rinses, toothpaste. Your dentist can apply it to your teeth in the dental office by a fluoride varnish, or your dentist can prescribe you a higher percentage of fluoride toothpaste. The most cost-effective way is through the public water source. Adding fluoride to public water is safe. Fluoride's effectiveness in preventing tooth decay extends throughout one's life, resulting in fewer and less severe cavities. That said the former Surgeon General Vivek H. Murthy. Centers for Disease Control and Prevention, or the CDC, has proclaimed as one of the 10 great public health achievements of the 20th century. Fluoridation of community water supplies is simply the adjustment of the existing naturally occurring fluoride in drinking water to an optimal level for the prevention of tooth decay. Think of it this way. Water that has been fortified with fluoride is similar to fortifying milk with vitamin D. Table salt with iodine and bread and cereals with folic acid. The number of communities who make the choice to fluoridate their water continues to grow. The latest data shows that in 2014, 74.4% of the U.S. population on public water systems, or 211.4 million people, had access to optimal fluoridated water. See how safe it is? Fluoride, according to this chart, the U.S. Department of Health and Human Services announced that with this, how much is 0.7 milligrams per liter of water? Well, we can compare it to in 23 miles, it's only 1 inch. Or if you compared it to minutes and days, it's 1 minute in 1,000 days. So what difference does a little fluoride make? It makes a big difference. The public health benefits are big. Before water fluoridation, children had about 3 times as many cavities. 5 reasons why fluoride in water is good for communities. 1, prevents tooth decay. Fluoride in water is the most efficient way to prevent one of the most common childhood diseases, tooth decay. One study has shown that children who live in communities without fluoridation are 3 times more likely to end up in the hospital to undergo dental surgery. 2, protects all ages against cavities. Studies show that fluoride in community water systems prevents at least 25% of tooth decay in children and adults, even in an era with widespread availability of fluoride from other sources, such as fluoride toothpaste. Why fluoride is called nature's cavity fighter. 3, it's safe and effective. For more than 70 years, the best available scientific evidence consistently has indicated that community water fluoridation is safe and effective. It has been endorsed by numerous U.S. Surgeon Generals, and more than 100 health organizations recognize the health benefits of water fluoridation for preventing dental decay, including the Centers for Disease Control and Prevention, the American Medical Association, the World Health Organization, and the American Dental Association. 4, it saves money. When it comes to the cost of treating dental disease, everyone pays, not just those who need treatment, but the entire community. Through higher health insurance premiums and higher taxes, the average lifetime cost per person to fluoridate a water supply is less than the cost of one dental filling. Number 5, it's natural. Fluoride is naturally present in groundwater and the oceans. Water fluoridation is the adjustment of fluoride to a recommended level for preventing tooth decay. It's similar to what I said before with, putting the iodine in salt, vitamin D in milk, orange juice has calcium, bread with folic acid. So here's a breakdown of the cost of water fluoridation versus other fluoride options. Here's looking at a fluoride mouthwash. That would cost you about $3 at the store. Here's some fluoride toothpaste. That would cost you about $2.50 per tube at the store. This fluoride varnish costs $20 to do at the dental office. A fluoride prescription costs $20 per tube, where water fluoridation costs only $1 per year. So how can we get fluoride added to the water for Utah County? We need to vote yes on the ballot to add fluoride to the public water source for the 19 communities in Utah County that are lacking fluoride in the water. Just like this dentist did, he was able to keep water fluoridation in Brooksville, Florida. So Utah County really needs water fluoridation. Thank you.